Maya Warnock was born on the 18th of June 2021 at the Bristol Children's Hospital, where ultimately she would return. Her parents, Samuel and Jasmine, had been in a relationship since 2017. They lived on Cornfield Road in the county of Wiltshire in the United Kingdom. There was a period in 2018 when the parents separated. Now, this Maya Warnock case is the first one I'll speak to you about. After this, I have a really sad, just sad case I need to share with you, so please stay tuned. During the separation, Jasmine reported domestic assaults by Samuel to the police, describing him as controlling and jealous, although she did go back on the accusations she made, saying that a new boyfriend had forced her to make a mistake. They go back together, and this is when Jasmine fell pregnant with Maya. After the birth, they had a good deal of support from both sets of grandparents, who would take Maya regularly for days and nights to give the parents a break. Jasmine went back to work shifts at a local pub, leaving Samuel in sole charge at home when Maya was not with the grandparents. Now, there were a number of occasions after Maya was born when the grandparents, they noticed bruises on the baby and they pointed this out. Jasmine said Samuel had lost feeling in his hands, which caused him to grip the baby too hard, which led to the bruises. That's a bit weird. In fact, Samuel reported numbness to the GP at that time, and tests showed no significant lack of feeling in his hands. Was he lying? And if he was, what a bizarre thing to lie about. On other occasions, he described having slipped on the stairs holding Maya, blaming a weak knee. Again, he went to the GP and X-ray showed his knee had no problems. In fact, friends even noticed that Samuel was being reckless in his handling of Maya, holding her up like the baby lion in The Lion King, waving her around, not supporting her head, which wobbled. So, on September the 18th, 2021, Samuel called 999, reporting that Maya was limp. She was struggling to breathe and that her eyes kept rolling back. Paramedics attended and assessed the baby. They found her heart rate normal, she appeared settled, and there was no sign of any breathing difficulties. They concluded she was okay. But during this bizarre incident, Samuel told the operator that the infant had thrown a fit and died because she was crying so much. What do you mean she died? And what do you mean she crying so much? The paramedics clearly saw nothing is wrong with the baby. Now, on Sunday the 19th to Monday the 20th of September, Maya was staying with her grandmother. She reported that Maya had been unsettled, crying as if in pain when she was picked up. She then brought Maya back to Samuel's house on the Monday evening. In the next 25 minutes until Jasmine returned from work, Samuel was alone with his daughter. Jasmine came back to find him on the phone to the emergency services again. Maya was unresponsive, clearly very unwell. When paramedics arrived, they noticed the entire house smelled of cannabis and that there were drugs on the table. In fact, during this moment, Samuel went upstairs to his bedroom to smoke cannabis, and he only re-emerged after his mother-in-law came in and said, "Yo, get your ass downstairs, go be with your daughter." He then returned and was noted by paramedics to be agitated and aggressive, shouting and swearing while they were checking Maya. Imagine that. Doctors come, right? And then your daughter's like on the floor, who knows if she's still alive, and you go upstairs to go and have a spliff. What? So when the paramedics checked on Maya, she was not breathing and she had no pulse. She was deeply unconscious. They managed to restore spontaneous circulation and breathing. She was then taken to Bristol Children's Hospital, where she remained for the next month. When arriving at the hospital, Samuel described her as a drama queen. He said, "Oh, she's always like this. She's just a drama queen." Drama queen? This is a child, you muppet. Unfortunately, Maya never regained consciousness. Brain scans showed widespread brain damage. Examination of Maya's eyes showed abnormal bleeding. Her blood vessels thickened in her eyes. Both of these are signs of a shaking injury. The parents were told she was unlikely to survive. More examinations indicated cervical nerve root damage, which was indicative of the baby's head being twisted back and forth. There was no sign of rib fractures often seen with gripping, nor any skull fracture. However, X-rays showed a partially healed fracture to Maya's left foot, indicating a compression injury in the 2 weeks prior to her admission to hospital. Now, the cause of death was recorded as a non-accidental injury to the brain in a single incident. Now, what the hospital staff found bizarre was the behavior of Samuel and Jasmine. You see, they only attended the hospital sparingly to see their daughter in the month she was there. Staff noted that they only stayed a short time. The parents claimed they had a young puppy to get back to. I mean, think about it. Having a baby in hospital who you have been told is unlikely to survive, it's a highly stressful situation for any parent, and people will respond differently. Sometimes we respond bizarrely to grief and stress. But what did Samuel do? He sent messages from the hospital asking people to bring cannabis and to sell cannabis for him. In fact, on the 6th of October, while the child is in the hospital, a social worker called home to speak to Jasmine. She heard Samuel screaming and shouting at the young puppy, further indicating his anger. But then, on the 19th of October, Maya died from a brain bleed. Samuel Warnock was charged with Maya's murder. Jasmine was charged with causing or allowing her death. They were both aged 27 at the time she died. The trial was scheduled to start on the 15th of January 2024. It was revealed that Jasmine became estranged from her parents, who did support her during this ordeal, but then they stopped talking to her as a result of her minimizing Samuel's actions towards Maya. You see, Jasmine's family took care of Maya, and they have been cruelly affected by her death. And of course, all deaths leave a sad loss, but there is something particularly wretched about the death of a baby. They're so vulnerable and defenseless. Who would do such a thing? Now, Samuel claimed that her breathing was staggered and he was trying to cool the bottle down and picked her up and started to give her her milk bottle. It was heard that in later police interviews, Samuel said Maya was fussing and he thought she was hungry. He said Maya began to cry, so he ran downstairs to get her a bottle. When he returned, he realized Maya had pushed her dummy out and was pushing her arms out and kicking her legs, and she was screaming. While she was screaming, he kept saying, "Baby, it's okay." He then claimed he looked at her, put her back on his chest, and just started slowly twisting her. Her head started bobbing up and down, and then she was gone. Now, according to the judge, this twisting caused a high risk of death. It was either that or grievous bodily harm, also known as GBH. But the judge said he could not be sure that Samuel intended to cause harm when he did this to his daughter that night. However, the judge concluded he was very reckless, the most prominent being signs of previous mistreatment and past injuries to Maya. In addition to this, Samuel had previous convictions for violent offenses, including battery, criminal damage, and assaulting an emergency worker. Clearly, his mistreatment of his daughter was in gross breach of trust as Maya's father. Moreover, he was dealing Class A and Class B drugs as revealed by the text messages on his phone. Maya's vulnerability as an infant is what gave rise to the high risk of death by causing her head to swing back and forth, and babies' neck muscles are insufficiently developed to protect them, which is why a baby's head always need to be supported. Furthermore, according to the police, there was a pattern of domestic incidents by Samuel towards Jasmine, and this did contribute to a picture of a recklessly irresponsible father. He was prone to anger, easily frustrated, profoundly needy, and consequently dangerously incapable of caring properly for a tiny new baby. So the judge told Samuel For the manslaughter of his baby daughter, he was sentenced to 14 years. As for Jasmine Warnock, well, she was aware of her husband's aggressive nature. She was charged with the offense of child cruelty. It's believed she gave birth again during the court proceedings and that this child is being cared for by foster parents. The judge said he is aware social services regard her as a loving and caring mother, but this son, who's been given to a foster family, is highly unlikely to be returned to her care while she remained living with the wider Warnock family. So to avoid jail, she stressed her intention to live independently, to work and provide a new home for this son, so that she can live with him. And to end this story, I'm going to read out to you what the judge said to her directly, and I want you to tell me your thoughts. I want you to tell me how much she is culpable. He said, "There is no question that you loved Maya very much. You were not present when the injuries were inflicted, and yourself inflicted no injuries at all to Maya. You knew nothing about the foot injury, which would not have been apparent. You intervened to stop Samuel on the Lion King occasion. The basis for your liability for child cruelty is that your knowledge of Samuel's volatility, his cannabis use, his tendency to anger, and the bruising to Maya, which was noticed by others and pointed out by them to you, should have acted as a warning that Samuel was mistreating your baby. Maya was too young to tell you what he was doing to her, but you should have read it in the bruising, which was plain to see. Instead, you ignored the red flags, you disregarded what your parents were telling you, and you brought in excuses. These excuses were the numb hands I mentioned previously, falling down the stairs with a weak knee, etc., etc. The judge said, the prosecution accept that you are to some extent a victim yourself of Samuel's controlling. He was coercive and volatile, and that this impacted your ability to recognize what he was doing or to influence or prevent him from doing it. It puts you into the lowest category of culpability, but it did not render you entirely powerless to act to protect her. Do you agree with the judge's assessment, basically saying you should have done something, but you're not culpable? He concluded that she had no previous convictions and are effectively a person of good character. She was badly affected by her daughter's death. She also claimed she ceased using cannabis. She was sentenced to a 3-year community order. I don't know about Jasmine's sentence, but in terms of the father, Samuel, he twisted her neck. I have an infant daughter myself. When you pick up a child, they do kind of flop a little bit because they don't have the support system built yet. So you can't help but lift your hand up and hold their head. For the parents, or for those of you that have held an infant, you know what I mean, right? It's just a natural reaction. So I think he did all of this on purpose. Whatever it was, he was pissed off and he took it out on her. Classless wanker. I also came across the story of Haley McFarlane. This story is just so sad. In fact, it's so rare, this story, that the only image available was this. There's no image of Haley. There's no image of the child. This is purely an artist rendering from the courthouse. But let me proceed anyway. So on the 10th of July, 2023, Haley gave birth to her daughter Evelyn. Haley was 39 at the time, but she suffered anxiety and depression when she was 21. And regarding her past, she was brought up in South Yorkshire. She was bullied at school, but she did well academically. She left school at 16 and she went on to Barnsley College, where she completed her A-levels, then went to university. She completed her degree in theatre, film and television. This is where she met her partner, who is the father to Evelyn. Now, prior to the crime, she checked herself into the prenatal mental health team at the Yorkshire Trust. She reported that she was worrying about getting things right for Evelyn. She felt a constant dread that her mental health was affecting the baby and that she felt guilty. She was worried about the girl meeting her developmental milestones, and nobody was there to help Haley with Evelyn, not even her husband. She felt he was absent. Haley was not able to sleep and she started to lose weight after the birth. But she did go to see the doctors and eventually was discharged. However, on October the 31st, she was seen urgently by the consultant at the psychiatric care and the nurse from the postnatal health team in Dewsbury. Her friends were starting to get worried about her and her demeanor. This is because when they observed Evelyn, she was judged to be healthy, meeting her milestones to be feeding well and putting on weight. Hayley, however, was thought to be suffering from symptoms of postnatal depression, anxiety, and some OCD type behavior. Evelyn was the focus of her depression and anxiety. In fact, Hayley actually refused to take the baby anywhere. She was frightened that something may go wrong. Because of this, she then was prescribed an antidepressant, but she refused to take the medication because she was worried that it might poison the baby. So on the 2nd of November 2023, she took Evelyn downstairs. She then filled the kitchen sink with water and placed her in the sink. Suddenly, she stopped and realized what she's doing. Her husband ran into the room and Hayley told him that she had thoughts of harming Evelyn. But then she had this overwhelming need to be saved. So they decided to take her as a voluntary patient to Fieldhead Hospital in Wakefield, where she was diagnosed with severe postnatal depression. She had delusional beliefs regarding her baby's well-being and other psychotic symptoms. She was then transferred to the Leeds Mother and Baby Unit. She had severe depression because she felt she was failing Evelyn and was not caring sufficiently for her. After a few days of continuing symptoms, she was prescribed antipsychotic medication, but struggled to decide whether to accept the medication and had exaggerated worries about her. Now, because she struggled with this decision to take the medication or not, and that she lacked the capacity to understand what was going on, she was then detained under the Mental Health Act. But slowly, over time, she responded well to the medication, going from being profoundly depressed with fixed negative beliefs to being bright and reactive. Over time, she was seen to be very gentle with Evelyn. Given this improvement, she was no longer under the Mental Health Act. After this improvement in her mental state, she agreed to remain in hospital informally. She remained an inpatient at the Leeds Mother and Baby Unit until December 2023. On that day, she was seen by a trainee psychologist who described her progress very positive. There was a Christmas party which she attended. However, that afternoon, she was permitted to take Evelyn out for a walk by herself. She went to Hyde Park in Leeds, and it was during this walk she took Evelyn's life. She smothered her with a cloth which she placed over her face. She then called her husband and called the emergency services. She told the operator immediately about what she did. When the police arrived, she told them that she did this to her baby, that it was awful and terrible, and that she should be taken away. She was hysterical and told the police that she deserved everything that was going to happen to her. She did not deny anything that she did. She was then ordered to be assessed by 2 psychiatrists. She had 2 interviews, and these took place in 2024. The psychiatrist concluded that she was suffering from severe depression, with psychotic symptoms that she had been suffering for a number of months following the birth of her daughter. The formal diagnosis was of postpartum psychosis. And of course, this is a severe mental health condition which can occur in some women shortly after childbirth. The condition is a rare one, but when it's present, it poses significant risks to both the mother and child. Typically, the condition will be characterized by psychotic delusions, impaired judgment, impulsivity, and a lack of insight. And to all you men watching, when your partner gives birth, you being there is critical. It's paramount. Trust me. The support system is everything. The doctor said that when Hayley took Evelyn's life, she was in a psychotic state, and her thoughts and actions at the time of the offense were driven by psychotic experiences or beliefs. These symptoms were also associated with depressive symptoms, including poor sleep, low mood, and problems with concentration. The doctors further explained that postnatal depression and psychosis are linked conditions in the sense that moderate depression, if undertreated, can develop into this psychotic state. They said that she was vulnerable to developing depression and had experienced the condition in the past. This predisposition to depression, in conjunction with her perfectionist type of personality and the hormonal changes of pregnancy, had led her to experience depression after Evelyn's birth, which developed into psychosis. So the two psychiatrists described a direct link between her psychosis and the crime she committed. The doctor said, you can never know what's going on in someone's mind. However, it was unlikely that the antipsychotic medication was at a therapeutic level. He said that her condition made her feel that she was harming Evelyn, that she was not good enough and she was unable to look after her. In conclusion, if it wasn't for this illness, she would not have harmed Evelyn. So with all of this, the judge was weighing up how he should proceed with Hayley. He said that he had read a large number of the character references from members of her family and friends who spoke of her as very caring and empathetic. The judge also believed that Hayley acknowledged the enormity of what she had done and the devastation she caused Evelyn's father and her wider family. Therefore, he convicted her of infanticide and ordered her to be readmitted to the hospital. Or in other words, she was found guilty by reason of insanity. And the reason why I wanted to share this with you is because, like I said, it wasn't really on the news. I don't think many people are talking about it, but it's just such a sad case. Because I do think the outcome is correct. She was obviously mentally sick, never had a bad bone in her body regarding no criminal history or previous incidences of, with the child services or anything of that nature. And I think she was just sick and she needed help. And like I said earlier, the moment a woman gives birth, the family around her, her partner at the time, their influence, their presence is vital. Thank you for watching.